Hi, welcome all. Welcome to our channel Microbiology Made Easy. So here I will give you the information regarding the today's video regarding the most important burning topic, that is COVID-19, lab diagnosis of COVID-19 infection. So it is a pandemic infection. Our nation is suffering with this infections. So there is a confusion of diagnostic tests for COVID-19. So I will give you the brief information regarding this. So here it is the diagnostic test for COVID-19. So here the two types of tests are there, direct test and indirect tests. So direct tests are will detect the presence of virus. So indirect test will gives us the immune response. Next, the presence of virus will be detected with the RTPCR antigen test. So immune response, that is will be detected with the antibody. So nothing is there. The direct test will detect the RNA virus. Indirect test, the antibodies will be observed. So these are the two types of tests for COVID-19. So next, diagnostic test for COVID-19, that is the test merits and demerits. The test name is RTPCR, which is highly sensitivity and specificity. So here it is costly. It is a costly and time consuming. It will take 3 to 4 hours. So next, antigen test. So that is highly specificity and cost effective. So low sensitivity. Next, antibody test. Here it is cost effective and mass examination. The mobs will be detected. So 10, 15 members, so many members are there for easy detection. Will go for antibody test. So here it is not for early diagnosis. So early diagnosis is not possible with the antibodies. So RT-PCR for early diagnosis, antigen antibody for late diagnosis, not for early diagnosis. So RT-PCR it is not a rapid test. Antigen and antibodies are rapid tests. So RT-PCR for nucleic acid analysis. So next, we'll go through the RT-PCR, importance of RT-PCR. It is a gold standard test. Antibodies test, that is for acute infection and epidemiological purpose. So we are going for the antibody test, that is for acute infection and epidemiological purposes. So next, clinical symptomatic stage, that is 4 stages will be there, that is asymptomatic, symptomatic, decline, convalescent. So asymptomatic stage, so the patient won't get any symptom, that is the days 0 to 5 days, the patient won't get any symptom, that is asymptomatic stage. The symptomatic stage will be observed with 5 to 15 days, that is symptomatic stage. The patient feels fever, headache, then body pains will be observed. So that is 5 to 15 days. So decline, so the RNA replication will be stops, that is decline phase, that is 15 to 21 days. The next 21 to 28, that is patient will recovers, that shows that is 21 to 28 days. So these are the 4 stages: symptomatic, decline, and convalescent stages. So here it is the stages of the symptoms. Next, antibodies, appearance of antibodies, detection of antibodies. So first contact with SARS-CoV-2. So we'll detect the RNA. So that is asymptomatic stage. Also, we can detect the RNA virus. So RNA will be detected. So next, onset of symptoms will be observed with 5 to 10 days. Symptoms will be appears after 5 days. So here, after 7 days, the antibody will appear. The antibody after 7 days, that is IgM, will be detected. So next, IgM will be detected at the 7th day. So next 14 days, after 14 days, the 14th day will detect the IgG antibody. So IgG and IgM will be detected after 7 days only. So here we'll detect the antigen and RNA at the asymptomatic stage. The next IgM will detect it after 7 days. So after 14 days, IgG antibody will be detected. So next, interpretation of the antibodies and PCR test. So anti-PCR is negative, IgM is negative, IgG negative. So here the patient is COVID negative. So here it is RT-PCR positive, IgM negative, IgG negative. That is COVID preclinical stage. So COVID positive, but the patient is preclinical stage. RT-PCR positive, IgM positive, and IgG negative. So that is after 7 days. So after 7 days only we'll detect the IgM antibody. So RT-PCR negative, IgM positive, IgG negative. That is after 7 days. So here it is RT-PCR negative, IgM positive, IgG positive. Here it is low viral load. So less, we can't detect the RNA load, RNA virus, but we can observe the antibodies. So these are the different interpretations of the COVID-19 test. So next simple analysis is RT-PCR and IgG. That is RT-PCR positive and IgG negative. That is patient is COVID positive. RT-PCR negative, IgG negative. That is COVID negative. The patient is COVID negative. Next is RT-PCR negative, IgG positive. That is the patient is immunized. So here it is a simple analysis. COVID positive, COVID negative. COVID positive means RT-PCR positive. COVID negative means both are negative. So we will detect only IgG antibody means the patient is immunized. So thank you. Please follow the corona prevention. That is keep clean your hands, disinfectant, and as symptoms, you should aware of the symptoms. Thank you. Please do subscribe our channel Microbiology Made Easy. Thank you for listening my videos. Thank you. Please do subscribe my channel. Thank you very much.